That's the status quo in America, and it is a status quo that is unsustainable for this country. We can't have a system that works better for the insurance companies than it does for the American people. We need to give families and businesses more control over their own health insurance, and that's why we need to pass health care reform. Not next year, not 5 years from now, not 10 years from now, but now. Now, since we took this issue on a year ago, there have been plenty of folks in Washington who've said that the politics is just too hard. Too hard. They've warned us we may not win. They've argued now is not the time for reform. It's going to hurt your poll numbers. How's it going to affect Democrats in November? Don't do it now. My question to them is, when's the right time? If not now, when? If not us, who? Think about it. We've been talking about health care for nearly a century. I'm reading a biography of Teddy Roosevelt right now. He was talking about it. Teddy Roosevelt. We have failed to meet this challenge during periods of prosperity and also during periods of decline. Some people say, well, don't do it right now because the economy's weak. When the economy was strong, we didn't do it. We talked about it during Democratic administrations and Republican administrations. I got all my Republican colleagues out there saying, well, no. We want to focus on things like cost. You had 10 years. What happened? What were you doing? Every year, the problem gets worse. Every year, insurance companies deny more people coverage because they've got pre-existing conditions. Every year, they drop more people's coverage when they get sick, right when they need it most. Every year, they raise premiums higher and higher and higher. Just last month, Anthem Blue Cross in California tried to jack up rates by nearly 40%. 40%. Anybody's paycheck gone up 40%? I mean, why is it that we think this is normal? In my home state of Illinois, rates are going up by as much as 60%. You just heard Leslie, who was hit with more than 100% increase. 100%. One letter from her insurance company, and her premiums double. Just like that. And because so many of these markets are so concentrated, it's not like you can go shopping. You're stuck. So you've got a choice, either no health insurance, in which case you're taking a chance if somebody in your family gets sick, that you will go bankrupt and lose your home and lose everything you've had, or you keep on ponying up money that you can't afford. See, these insurance companies have made a calculation. Listen to this. The other day, there was a conference call that was organized by Goldman Sachs. You know Goldman Sachs. You've been hearing about that. All right. So they organized a conference call in which an insurance broker was telling Wall Street investors how he expected things to be playing out over the next several years. And this broker said that insurance companies know they will lose customers if they keep on raising premiums. But because there's so little competition in the insurance industry, they're okay with people being priced out of the insurance market because First of all, a lot of folks are going to be stuck, and even if some people drop out, they'll still make more money by raising premiums on customers that they keep. And they will keep on doing this for as long as they can get away with it. I mean, there's no secret they're telling their investors this. We are in the money. We are going to keep on making big profits, even though a lot of folks are going to be put under hardship. So how much higher do premiums have to rise until we do something about it? How many more Americans have to lose their health insurance? How many more businesses have to drop coverage? All those young people out here, after you graduate, you're going to be looking for a job. Think about the environment that's going to be out there when a whole bunch of potential employers just tell you, you know what, we just can't afford it. Or, you know what, we're going to have to take thousands of dollars out of your paycheck because the insurance companies just jacked up our rates. How many more years can the federal budget handle the crushing costs of Medicare and Medicaid? That's the debt you're going to have to pay, young people. When's the right time for health insurance reform? Is it a year from now, or 2 years from now, or 5 years from now, or 10 years from now? I think it's right now, and that's why you're here today. Now, Leslie is a single mom, just like my mom was a single mom, trying to put her daughter through college. She knows that the time for reform is now. Natoma Canfield, self-employed cancer survivor from Ohio, she wrote us a letter. Last year, her insurance company charged her over $6,000 in premiums, paid about $900 worth of care. Now they've decided to jack up her rates 40% next year, so she's had to drop her insurance, even though it may cost her the house that her parents built. Natoma knows it's time for reform. Laura Klinska, this is a friend of mine, somebody I met when I was campaigning in Wisconsin, Green Bay, Wisconsin. She's a young mother. She's got 2 kids. She thought she had beaten her breast cancer, but later discovered it had spread to her bones. She and her husband had insurance, but their medical bills still landed them with tens of thousands of dollars worth of debt. And now she spends her time worrying about that debt when all she wants to do is spend time with her children. I just talked to Laura this past weekend. And let me tell you, she knows that the time for reform is right now. So what should I tell these Americans? That Washington's not sure how it will play in November? That we should walk away from this fight? Or do something like some on the other side of the aisle have suggested? Well, we'll do it incrementally. We'll take baby steps. We'll do well. So they want me to pretend to do something that doesn't really help these folks. We have debated health care in Washington for more than a year. Every proposal has been put on the table. Every argument has been made. I know a lot of people view this as a partisan issue, but both parties have found areas where we agree. What we've ended up with is a proposal that's somewhere in the middle, one that incorporates the best from Democrats and Republicans, best ideas. Think about it along the spectrum of how we could approach health care. On one side of the spectrum, there were those at the beginning of this process who wanted to scrap our system of private insurance and replace it with a government-run health care system like they have in some other countries. Look, it works. It works in places like Canada, but I didn't think it was going to be practical and realistic to do it here. On the other side of the spectrum, there are those who believe that the answer is just to loosen regulations on insurance companies. This is what we heard at the healthcare summit. They said, well, you know what? If we had fewer regulations on the insurance companies, whether it's consumer protections or basic standards on what kind of insurance they sell. Somehow, market forces will make things better. Well, we've tried that.